Division of Behavioral Health. And I oversee our Office of Prevention and Crisis Services. So like I had shared earlier, I've been with the division for about 9 years. Prior to my current role, I had managed our division's budget and contracts and financial pieces. And then about 6 months ago, I accepted the assistant director position, so focusing more on the programmatic side of our division. That is me. So what I wanted to share with you today is covering an overview of the Division of Behavioral Health, some of our supported prevention activities, some resources that you might find helpful to you as you embark on your prevention journey and providing services, and some time for question and answer. So as the Division of Behavioral Health, we support children and adults with serious mental illness. We serve adolescents and adults with substance use disorders and youth and adults, young adults in need of prevention services. And I would add here, we also are working on our crisis services piece. So as you've heard about 988, I'll talk more about that later in the presentation. But we really provide oversight of the publicly funded behavioral health system. And so what do we mean by publicly funded behavioral health system? That means services that are either receive state general funds, federal funding, so whether that's from the Substance Abuse and Mental Health Services Administration or other federal funds, Medicaid, anything that's really public funding. And then we provide services such as outpatient mental health services, outpatient and inpatient substance use disorder. Recently, we're starting to implement support and recovery services, and then as well as our prevention and crisis services. So then as we continue on the slides, I'll talk a little bit more in detail about some of those and then really focus more on our prevention pieces. So as some of you may already be aware, there's the 11 community mental health centers that are in South Dakota. Some of you have mentioned that you maybe are working at them. Human Service Agency is one of those. So you can see where they're covered. So every community mental health center has what we call a catchment area, or an area of counties that they're required to provide services to. So we have some core services that they cover, including outpatient mental health treatment. We have some specialized children and youth family services, services to adults with serious mental illness, and that's our care services or comprehensive assistance with recovery and empowerment. Impact is individualized mobile programs of assertive community treatment. So again, adults with serious mental illness, but those that are needing some more significant, almost daily assistance to live their daily lives. And then some other services that we have available, emergency services. Every mental health center is required to have 24/7 on-call services. We have our indigent medication program, which provides psychotropic and medication-assisted treatment for individuals who can't afford their medications or their copays. We have what we call our family support program, which provides support to youth and their families who are at risk or engaged with the justice system, and helps provide some of those other needs that people may have. So whether a family doesn't have a bed to sleep on, or kids don't have clothes, or they maybe need help with minutes or gas cards. So the family support program provides some of those other types of support services. And then our PATH program is Projects for Assistance in Transition for Homelessness. So doing some outreach to individuals who are homeless, and then also supporting some rental deposits, security deposits for those individuals, and then treatment services for justice-involved youth. So things like functional family therapy, aggression replacement training, and moral recognition therapy are what we support there. So that's through our community mental health center system. And then on our substance use disorder treatment side, we contract with substance use disorder treatment and then obviously prevention agencies to provide kind of a wide array of services, from outpatient, your assessments, early intervention, up through inpatient, level 3.7 services. You can see the list there. And here again, we have specialized services for intensive methamphetamine treatment, pregnant women and women with dependent children, and justice-involved services for justice-involved youth, SAPST, cognitive behavioral interventions for substance abuse, and moral recognition therapy there as well. So we have, I think it's 6 intensive methamphetamine treatment programs out in Pennington, Rosebud, several in the Sioux Falls area, Mitchell, and then Aberdeen at Avera St. Luke's, Avera Addiction Care Center. And then our 2 pregnant women's programs are first Full Circle at Behavior Management Systems, and then New Start at Volunteers of America. I am going to pause there and just see if there's any questions so far about just kind of our general behavioral health services, or if there's anything that I can answer on that part. Otherwise, then I'll start moving more into our prevention related pieces. Okay. So prevention supported activities. So we know prevention is effective. We have our prevention and early intervention strategies. We can reduce the impact of substance use and mental health. As you guys all know, prevention activities work to educate and support individuals and communities to prevent substance use and misuse of drugs and the development of a substance use disorder. Really, as we all know, substance use and mental health disorders can make daily activities difficult and really impair a person's ability to live their daily life and interact with family and friends and all that. So in general, that's what we're here to support, is how we can prevent a substance use disorder. So before somebody gets more into the deeper end of the system and needing some higher levels of care. There we go. So as Dodie and Michelle had shared, they are with our prevention resource centers. So they can obviously speak more in depth about exactly what their day-to-day looks like. But in general, our prevention resource centers are providing regional support to students, parents, educators, community groups, agencies, law enforcement, and really anyone that's looking for some prevention resources or materials. Each PRC has a resource library that's available to use. And did you guys get your Overdrive account up or not yet?
Not yet. It's hopefully by May.
Okay. So right now it's a physical library, but we are working, the PRCs are working to get it available virtually so that there are some resources available that you can check out through like ebooks and on an electronic platform. So it was great to have them bring that to our attention that was available and able to support. So that'll be coming soon. And then PRC staff also provide training and education in the areas of prevention. And so we really focus on evidence-based practices and materials are available for substance misuse. I believe you guys have some mental health related items in your libraries, bullying, tobacco. I'm trying to think if there's anything else that I am missing on your area. So if you guys want to weigh in with anything on the PRC side, if I covered it.
I think you're good.
All right. So moving more on to our provider partners, the coalitions that we have. So there are the 3 PRCs that we had on the prior slide. And then we also have coalitions throughout the state that are providing direct services as well. So 21 substance use prevention providers. So 3 PRCs and then 20 coalitions are who we're providing funding to today. Efforts focus on school, communities, or individual-based programs, evidence-based, school-based programs. We have focusing on classroom presentations, early identification and screening. And we have some community-based programs focusing on establishing or changing community standards, policies, attitudes towards substance use, and individual programming focusing more on specific interventions to individuals who are at high risk of developing a substance use disorder. So, and the one thing that I really want to note here, in 2019 was the first time that we were allocated state general funds in the prevention area. So we were really excited about having that opportunity. Those general funds really focus on meth prevention and school-based meth prevention. Some of the curriculums that are used in that area, the life skills training and Too Good for Drugs. And then I know there's more, Dodie and Michelle, that I'm blanking on, but those are the 2 that come to mind. So with some of the meth prevention funding, we were able to expand the number of schools that we were impacting with prevention services. And then as I continue on in these next slides, I see Rebecca is on. So we have some overlap between Department of Health with some of our prevention activities And so I have some slides on our state opioid response grant that we're a partner with Department of Health on some of our opioid activities, as well as suicide prevention. So I just want to share that I had taken a quick peek at Rebecca's presentation, and so we'll share some activities between what both departments are working on. So through our state opioid response grant, it's issued by the Substance Abuse and Mental Health Services Administration, or SAMHSA. It's federal funding that focuses on increasing access to treatment, reducing unmet treatment needs, reducing opioid overdose related deaths, using prevention, treatment, and recovery support activities. Our current SOAR grant allows funding to support not only opioid use disorder or preventing opioid use, but also stimulants. So we're excited about that. That was just a change within the last year or so to be able to add more of the stimulant piece for prevention or treatment. And so here are some of, on the slide, you can see some of our key strategies that we're working on our state opioid response grant. In the PDF that you receive, there should be a hyperlink out to our Avoid Opioid website. I would really encourage you to take a look at that. There's a lot of great resources out there, whether it's prevention related, treatment, or the recovery. There's talk about our care coordination program. I won't spend a lot of time talking about care coordination, focusing more on our prevention side of what we're doing with opioids. So on the prevention area, we have the youth and community prevention. So focusing on education, evidence-based opioid prevention program strategies to youth, helping develop community trainings regarding opioid education and awareness. We have our Avoid Opioid Awareness Campaign. Again, we're partnering with Department of Health on that piece. So we have a lot of great resources out there. There's print materials that you're able to access for free. There's different social media strategies that we've used, broadcast television and radio. And so some of our information, we've outcomes that we reported federally during our federal fiscal year, we've reached over 1.5 million individuals with the Avoid Opioid SD campaign. And then we have, let's see, I'm looking at my stats in my notes. So there's about over 35,000 visits to the Avoid Opioid, which was a 75% increase over the previous year. And over 540,000 South Dakotans have been reached with messaging on safe at-home medication disposal options via the social media campaign launch. And then on our prevention side, about 9,500 youth have been impacted by evidence-based programming in schools or after-school settings. And then more than 2,500 individuals across dozens of towns in South Dakota have participated in locally delivered training or town hall meetings regarding opioid education and awareness. So those are some of the activities that Dodie and Michelle and Bill are helping support through the opioid pieces. The next piece we have safe medication storage and disposal. So available free medication lock boxes can be requested and directly shipped to your home. I think it's one per household, one per address, I believe. We also have permanent drug take back sites that we partner with Department of Health and the Board of Pharmacy to help get those in different areas throughout the state. You can request a free Dispose RX packet to safely dispose of your medications at home. And so these are some activities that we're really excited about that have had a really good impact and response as we've been delivering those. We just had a really large increase in our lockbox requests that we've had. So, and then there's some links on the page here that you can go to Avoid Opioid to look at the take back sites and the medication lockboxes. Then we also have our overdose education and naloxone distribution. So working on equipping our first responders to be able to have the knowledge of recognizing what might be signs of an overdose and then the ability to also respond to them. So we have developed and launched an online interactive training that can be taken. It's an on-demand, it can be taken at any point in time. We have a statewide standing order allowing pharmacies to dispense naloxone to anyone at risk of an opioid-related overdose or those in a position to assist someone at risk. So if you have a family member or a friend who is at risk for having an opioid overdose, you can also go and request the naloxone to have available with you. And so again, there's funding assistance available for individuals who it's either not covered by their insurance or their copays are too high. We are able to provide funding to support that naloxone distribution.
Stacy, I do have a question about that. So with and it just came to my mind, we've been talking about this for what, almost over a year now, but if a loved one wants to have Narcan available or naloxone available, when they get that, do they promote going online to do that particular training?
So there is, I'd have to pull up the website and look at all of the steps, but I would encourage, I believe it's encouraged in their form of the response of going online to do the training. I don't know if it's required as part of it, but I think it's highly encouraged that those family members take the training as well. But we can pull up the website, we might be able to see more clearly. That just talks about what naloxone is, where to find it, and then there's some brief instructions on how to administer it, and then the free naloxone training. I would say not required, but probably encouraged. Get back to the PowerPoints. So, and with that, I'll be transitioning to suicide prevention. So before I continue on, are there other questions about the prevention, anything that I've talked about so far, or the opioid piece? Okay, cool. So transitioning more into suicide prevention. So during the summer of 2019, Governor Nome had made suicide prevention a priority and created an executive work group focusing. It's comprised of different cabinet secretaries throughout state agencies. So it includes the Department of Health, Department of Social Services, Department of Education, Tribal Relations, Veterans Affairs, and Agriculture and Natural Resources, as well as the Great Plains Tribal Leaders Health Board. And so that group came together to develop goals and strategies and objectives related to suicide prevention. We have work groups of the cabinet secretaries that regularly meet to monitor the activities. We're tasked with coordinating the suicide prevention efforts across the state. We have a 2020 to 2025 strategic plan, suicide prevention strategic plan. And right now our efforts are coordinated at the highest level of leadership through Governor Nome's dedication to reducing deaths by suicide in South Dakota. And then as part of the work, we had a broad array of input. Community stakeholders were convened to provide input on the 2025 strategic plan, implementation, and strategies across state agencies in the community. And then the multi-agency state sub-work groups meet monthly on the different strategies and priorities to determine where we're at with progress and what we can be working on and doing to improve and reduce suicides in South Dakota. So some of our key areas that we have our data area where recently we made updates to the existing data dashboard on the South Dakota Suicide Prevention website, allowing us to share information more timely. So at any point you can go out to the SDSuicidePrevention.org website to access the data. Our education and training, we're looking to provide culturally appropriate and evidence-based education and training to various public and professions throughout the state. Many of you are probably already aware we have mental health first aid training available at no cost. We're working on zero suicide initiatives to prevent suicides through zero suicide in healthcare and behavioral health settings. Let's try that. We have supported zero suicide since 2017. We've hosted some workshops, community of learning calls, and more recently we're re-engaging with zero suicide in the Education Development Center on what we can do to enhance zero suicide in South Dakota. And then more recently, we've been working on our Bright Spots presentation. So every month since September, I believe, every third Thursday, we've hosted a bright spot focusing on different successes that are happening in South Dakota, and those can be accessed on the sdsuicideprevention.org website as well, if you want to go back and watch any of those. We also have objectives focusing on our communications and our community engagement. So we've added a listserv function to the SD Suicide Prevention website. So we have quarterly newsletters that we send out. So if you're interested in receiving those, you can go sign up for the listserv. Then we also are working on community engagement, supporting community leaders to provide support to individuals before, during, and after a crisis. And so what we can do to help implement evidence-based programs and policies, focusing on suicide prevention. So there are toolkits as well on our website for different populations of who's implementing suicide prevention. And then I wanted to share some of our key accomplishments related to our suicide prevention. So we've been able to increase the awareness and availability of mental health and suicide prevention training. So in 2021, we had 65 trainings that were facilitated, reaching 1,442 individuals. Over the past 2 years, we've offered 126 trainings, reaching over 2,600 individuals. So with COVID kind of starting to hopefully be on the downswing, we're able to provide, there's more interest in providing some of those in-person trainings. There's also some that are available virtually as well. And so then we're also working, collaborating across our state agencies to share out on social media messages as well. And so having that key consistent messaging across our agencies and across the state agencies' social media platforms. So that's resulted in just under 56,000 page views to SD Suicide Preventions in 2021. There's also been resiliency trainings provided to first responders in South Dakota over the last 2 years, and 40 have received resiliency leadership training. And we have our 2021 priority strategies outcomes report available on the suicide prevention website as well. So you can take a look at all of the different data that we've been able to report and the different impacts that we've had out on that website. And again, the suicide prevention website, there's different data dashboards, so you can see some of the different metrics as those get updated. Transitioning now more to the National Suicide Prevention Lifeline. So many of you are probably familiar with the 1-800-273-TALK phone number. So in July, 988 will be launching. So, and what 988 really is it's changing from that one long 1-800 number. It'll still be active, the 1-800 number, but then to a shorter, easy to remember 3-digit number, similar to calling 911 for a physical health emergency. You can call 988 more for a mental health crisis emergency. So as the slide shares, it's the nation's public safety net for all American residents in emotional distress or suicidal crisis. So in South Dakota, our NSPL, the National Suicide Prevention Lifeline, is operated by the Helpline Center. So they're located in Sioux Falls, but they're answering calls across the state. So they're not answering just Sioux Falls area. They take calls from across the state. So, and then to share some history on 988 in December, can't remember what year it was, December 2019. The FCC had recommended that 988 be designated as the National Crisis Lifeline. And so then July 16th is when that launches officially. If you call 988 today, it will get routed to the 1-800-273-TALK number. So it's active, but not officially launched and live. And similar, after 988 goes live, the 1-800-273-TALK is still available and will still be answered. So then talking more in detail, implementation planning for 988. So as I've previously shared, there's some information here. So over the last year or so, we've had a stakeholder work group focusing on implementation of 988 and cross collaboration across multiple different organizations, from the Helpline Center to public safety answering points. So like 911, there's been a lot of different collaboration and coordination for 988 to be able to access this service. So we talk about some of the benefits of 988 being immediate access to mental health professionals. So those that are answering the phone are trained mental health professionals. On average, 80% of the calls received by trained crisis counselors are de-escalated without need for further intervention. And so what that means is they don't have to call and dispatch law enforcement to actually physically go respond. They're able to resolve those on the phone. And then some of the conditions that we've been considering with the planning coalition that we had, workforce availability and retention. And I know that's something that's across the state, building capacity for local response and receiving facilities. Local providers are essential to the successful messaging and promotion, and then monitoring the actual call volume. So we had done some work with Guidehouse related to projecting call volume, and Vibrant Emotional Health has some projections related to call volume. So we've been working and coordinating what do we expect call volume to be when 988 goes live. And then I wanted to speak a little bit about building the capacity for local response and receiving facilities. So over the last few years, we've had a ability to establish and create appropriate regional facilities so individuals who are in crisis are able to stay more close to home rather than being having to go to the Human Services Center for psychiatric support or to one of the private inpatient psychiatric units. So we're currently working with different agencies throughout the state on building some of that capacity and actually physically building buildings to allow for local crisis stabilization receiving facilities. And so then moving on to some resources, I wanted to share some of our DSS website resources. So if you go to our DSS Behavioral Health Services webpage, you can see we have information about our substance use prevention providers, our current prevention program strategic plan. We're working on revising our strategic plan, as well as some other local resources, some fact sheets, substance use prevention resources, and then the information that I shared related to the 988 and our grant funding and opportunities. There's a page for our grant funding and opportunities that's out there as well. So I'd encourage you to take a look at our website and review those resources. And then, as I had mentioned earlier, sdsuicideprevention.org website. So if you click on the state plans section, that's where you can get to the strategic plan that we have. There's the toolkits option, some of those community resources if you're looking to implement something related to suicide prevention. On this website is where you can also request materials at no charge. So we have toolkits, so not the actual toolkits for implementation, but we also have swag toolkits that you can request to hand out different materials for our Be the One campaign and Reach for Life. You can request free training through the website. And so that's some of the things that my team monitors and oversees on our end. So I would definitely encourage you to take a look at our website there, sign up for the newsletter. Last but not least, I also wanted to share for prevention, there is the Prevention Technology Transfer Center Network. So you can see the different regions. We are in the Mountain Plains Technology Transfer Center Network. And so what that does is it provides different technical assistance and resources, training opportunities for you. There's a platform that the PTTC hosts called Healthy Knowledge. So as you're looking to develop your prevention skill set, Healthy Knowledge is a platform that you can go to, as well as the PTTC website itself. And so they are a great resource for you in addition to some of the other resources I've shared. So with that, I want to say thank you, and I'm here for questions. I think I'm right almost at a half an hour, but any questions or anything that I can help answer for you guys?
One question that I did have is when you mention the opioid prevention lock boxes, and it's one per household. Generally, I know like in the medical field, they like people to keep their medications, especially controlled substance, separately. So do you see that that's something that the state might change and make more than one available in the event that you have two different patients with controlled substances that should theoretically, or best practice would be to be stored in separate locations by patient?
Sure. I don't have an answer for you right now, but I think that's something that we can take back with that feedback and take a look at and what that looks like.
Thank you.
It looks like, is there something in the chat? You're welcome.
Thank you so much, Stacy. A lot of great information. Really appreciate you presenting and taking the time to be with us today.
Yeah.
Before we transition over to Robin, do we want to just take like a quick 5-minute stretch break while she gets her PowerPoint set up?
Are you talking about Rebecca?
What did I say?
Robin.
Sorry,
Robin's
Rebecca.
going, I'm not presenting.
Yeah, Robin, you're up. Rebecca, Robin, yeah. Maybe, yeah, so let's just plan to be back at 10:30. Just give you a few minutes to stretch your legs, grab something to drink, and then we'll start back at 10:30.
Yep.
And I'm going to hop off. So thank you guys.
Thanks, Stacy.
Stacy.
Just checking, can you see my screen? And I'm assuming you can hear me, so I think we're good to go.
Yep. I don't think I was able to listen to your presentation last year, so I'm excited to hear the resources from DOH this year. So
So we have had some changes in our office, which is going to be interesting. So this is actually my first time presenting on our new changes because we have merged offices. So
okay,
we have 2 offices now working as one.
okay. I bet that's been had some challenges.
I have the hardest time remembering our new office name, to be honest. I'm so used to saying the Office of Chronic Disease and Health Prevention. I'm like, I have to remember there's no more chronic in there.
Oh, so it's just the Office of Disease Prevention?
Disease prevention and health promotion.
Okay. And do you oversee that? Or who oversees that office?
So Kylie Hump is our administrator for the Office of Disease
Okay.
Prevention and Health Promotion. I always keep looking over here because I have it written out because I will say the Office of Chronic Disease and Health Promotion. So Kylie Hump oversees that, and then we're actually broken up into 2 divisions. So we still have the Office of Disease Prevention and Health Promotion, which is under Laura Strike,
Okay.
who is our deputy administrator, and that still has like the tobacco program, the opioid program, all those programs. And then our second program is the Office of Disease Prevention, which is like your STIs, COVID,
Okay.
more of the preventing diseases. So it's interesting
Yeah.
to work with.
And where does Linda Arndt fit into all that?
So we are actually the Division of Family and I cannot remember our full name. So we're a full division. And then Linda is the administrator to family and child health. So
Okay.
she and Kylie are kind of the leader. So if you take our whole division, we're divided up into 2 groups. Linda's over here and then we're over here.
Gotcha. Yeah, Linda and I go way, way back from work related actually, but one of the first people I probably met when I was started in prevention 20 some years ago. So
Yeah.
No, Arkansas. I just want to say I'm digging my packet. I just went into the office. I was like, I didn't get a packet. And sure enough, there was a packet. And it's like Christmas morning. Thank you.
You're welcome. I had fun putting it together.
Yeah, there's some
I was
great
like, how much
stuff
stuff can I
here.
put in this and get away with it? And so what I'm assuming is that Bella will probably share her York peppermint patty with Michelle if she doesn't like the mint and the chocolate together. hmm
So I actually do like York patties.
Oh, okay.
I like Andes mints. I like those, but something about mint chip ice cream just doesn't do it for me. But if it's not cold and liquidy, then I can do mint and chocolate together.
Good to know. All right, so Michelle, are we ready to get going, do you think? All right, so we would like to welcome Rebecca to our today's resources presentation. She is from the South Dakota Department of Health, and we'll let her just kind of take over with introducing herself and what she's going to be talking about. So welcome.
Thank you. Good morning, everybody. My name is Rebecca Perotic, and I am the Communication and Community Coordinator for South Dakota Department of Health. And I work in the Office of Disease Prevention and Health Promotion. I do need to put a little bit of a caveat in here because I might say the Office of Chronic Disease Prevention and Health Promotion, as we were talking about during the break, if you overheard, but we used to be two different programs. So our office used to be the Office of Chronic Disease and Health Promotions, and then we had another program called Disease Prevention. And last fall, they actually merged our two offices together. So I am still trying to get used to this name change. It seems like they just took one word out, but I have been saying it for 3 years. So I do apologize if I confuse you by saying chronic disease. But today I kind of will be talking about all of our different programs. And the reason why I chose to do my presentation this way is because a lot of times we get calls from healthcare providers who say, I'm working with a patient who might be suffering from substance abuse, but they also need to maybe get screened for cancer, or they might also have another health problem that they need to address to help make their treatment more successful. So in today's presentation, I will be talking about all the different programs we offer. And again, this is just for the Office of Office of Disease Prevention and Health Promotion. We also still have WIC, SNAP, all of the maternal and child health programs. So I'm just going to focus on the disease prevention and health promotion side. But if you need other assistance with other programs Department of Health has, please feel free to reach out to me and I will get you in contact with those programs. Additionally, we do have an online catalog where you can find resources for numerous health problems, such as cancer, colorectal, diabetes, tobacco, opioid, suicide prevention, tobacco prevention. I believe my slides were sent out. So this is just at the bottom. So all you have to do is click there and you can find all of the resources we have available. I'm going to start with our cancer program. I know my slides have a lot of information on them. This is just for you to review later. I'm going to provide a brief overview of each of our programs. But again, if you need additional resources, reach out to me. So starting with our cancer program is made up of 3 individual cancer programs. The first one is comprehensive I cannot speak today, so I do call comprehensive cancer control program. Then we have our colorectal control program. And then we have our breast and cervical cancer early detection program, or All Women Count. And then additionally, we do offer multilingual resources, just because this is one of the biggest asks we have had in the last few years. I'm going to start with our comprehensive cancer control program. The overall goal of this is to reduce the human and economic impacts of cancer throughout South Dakota. Here they provide reports where you can get test screenings and numerous resources available. They go out and do sampling, research, and they also work with our healthcare providers to be partners to help with the screening process. Colorectal cancer program is focused on the early detection of colorectal cancer. If it is detected early enough, it is 100% curable. So our colorectal program works on setting up screenings, they provide resources, and then they work with healthcare providers across the state just on setting up screenings for people who might not have health insurance, or providing just information on where to even go to get cancer screenings. Moving on to our breast and cervical cancer early detection program, or All Women Count. This is helping women across the state of South Dakota address the barriers to basically get screened. So this is a program that's focused on low income, uninsured, underinsured women, and it provides screening and diagnostic testing. As you can see at the bottom of the screen, those are the eligibilities requirements for all women, for any women entering this program. So again, it's pap smears or even mammograms. And I just want to put out a promotional shout out to this program. This year they are celebrating their 25th anniversary of being a program in South Dakota, and they have helped thousands of women with early detection of breast cancer. And again, I just want to emphasize this for all of our cancer programs, but early detection is the key. It helps makes things more treatable, and it saves lives. So again, if you have a patient who maybe is behind on cancer screenings, please send them here. And then, as I said, we do have multilingual resources available if needed. Community health workers. This is a new program to the Department of Health. It was initiated in 2019. And what it is it's bridging the gap between healthcare providers and their patients. So a community health worker is a person who serves as a liaison and a guide for the patient. They can help with setting up patient appointments. They can make sure that, all their needs are being met. They work even with helping the patient understand when and where their appointments are, to even helping them with medication management. And also they can work on other needs such as maybe transportation and housing or food. So a community health worker is a vital part of healthcare. The fields that community health workers can work in are hospitals, clinics, community health centers, chronic disease management programs, behavioral health programs, addiction and substance abuse programs, Head Start programs, child abuse and prevention programs, employee benefit programs, insurance companies, and many, many more. So if you haven't worked with a community health worker, we are currently engaging them into communities, and what they have to do is they have to become certified. But once they certified, they work in individual communities. They are a trusted advocate for patients, and they have had tremendous success in the outcomes for patients. And then, as I said, that they have to go through various trainings. So there is a CHW, or Community Health Work Training Program in South Dakota. We have spent many hours with workforce development, and then the CHW planning and assessment tool goes through all the different aspects of a community health worker. So again, I recommend, as this program expands, I'm guaranteeing you, you might see a community health worker in your community or come in with a patient. So I recommend getting to know these community health workers and understanding their role they play with patients. Our next program is our diabetes diabetes program. And there are many different aspects of this program. So we have the diabetes program itself, which facilitates partners between the South Dakota Diabetes Coalition, healthcare systems, community organizations, and other stakeholders. They also have coalitions that implement the National Diabetes Prevention Program. I know it's the DPP, and I'm sorry, I always hear the acronym, so I do not know the full name, but we have coalitions across the state that have these DPP programs. So our diabetes program just make sure that they get the adequate training, that they maintain their training, and just have additional resources available. Our next program area in diabetes is our pre-diabetes program. And I would recommend, after you hear this presentation, go out to the Under the Risk website and take that pre-diabetes test, because 1 in 3 Americans have pre-diabetes and 10% of them know it. So the majority of Americans do not know they have pre-diabetes. And again, the reason why it's called Under the Risk is if you have pre-diabetes and you make health style changes, you're less likely to develop diabetes, type 2 diabetes. So this campaign has developed over the years, and it's interesting to do this. And I will tell you, I have taken the test a few times, and I have changed various factors on that test to see what are my risk outcomes, what are my challenges. And it's eye-opening, just from a personal standard. When our diabetes prevention manager came to me and said, "Hey, we're doing this," I'm like, really? I thought it was going to be scary. Took 5 minutes. So please have people go out there and take the test. And then finally, we have diabetes management, where we can work with, or we don't work with insurance plans, but we kind of just help patients guide to how to work with their insurance plans. Like we help them, help them know what questions to ask their insurance and how to understand what their insurance covers. And then second, we talk about like coping with diabetes, and not just as the individual with diabetes, but also being the loved one of a person with diabetes. And then, as I said, for every program, we have numerous resources out there. So feel free to peruse our catalog and see all the different resources we have for diabetes. Heart and stroke prevention program focuses on cardiovascular health and reducing the burden and eliminating disparities associated with heart disease and stroke. We do numerous programs out there. Some of the highlights I can tell you is this year we had our first cardiac ready community. A cardiac ready community is a community that has band together to work at making sure if somebody has a heart attack in that community or has a health related emergency, that community is ready to come together. And this community was actually Kimball. South Dakota. And one of the reasons why they actually got engaged in this is because they had a hunter go out into the field, suffered a heart attack, and nobody around him knew what to do, and the nearest hospital was Chamberlain. So now the community of Kimball has gone through AED trainings. They actually have many of the hunting lodges actually carry AEDs on their buses. And then the whole community as a whole has a response plan in case there is a cardiac event. I'm going to say this over and over, and I do apologize. Again, we have numerous resources available to help identify the signs of a heart attack, understanding heart disease, and then what to do after a heart attack. And then the same can be said for stroke. So the BFAST is one of the most important things to reduce the damages of a stroke. So we have resources provided there. We talk about living with the side effects of having a stroke, and then just kind of other friendly reminders. Our physical activity and nutrition programs are actually broken down into 2 different programs. So we have Healthy SD and Good and Healthy South Dakota. Just as a program update, our Good and Healthy website has recently been redone. So if you haven't been out there lately, feel free to. So starting with our Healthy SD program, this promotes healthy eating, health and wellness, and then physical activities. Some of the programs that are supported through Healthy SD is walking network support for walkable communities. And one of the programs highlighted here is every year we work with SDSU's architectural program, specifically their landscaping program. And what they do is they actually go into communities and help them design sidewalks and other safe walking environments. They come up with recommendations of how the community can improve. That can include building recommendations for building new sidewalks. That can be where to put in crosswalks, what signs to put in, and making it a better walkable community. The next program is Fit and Strong, which is a 8 to 12-week physical activity program designed for adults, especially elderly adults with arthritis. The classes activities include group discussion, goal setting, lower extremity strength training, aerobics, stretching, introduction to balance and upper body exercises. This is led by a leader and just helps build that confidence. Another program we have is Walk with Ease, which is a 6-month walking program that teaches safe ways to incorporate physical activity into daily life. And then we go over to our Good and Healthy. Good and Healthy was created by the Office of Chronic Disease and Health Promotion, which focuses on chronic disease prevention and information for the communities. This is community information for communities, schools, workplaces, childcare, healthcare, and tribes. I'm going to warn you, there's a lot on this website. There's model policies, there's different program information, there's funding opportunities. Through a lot of our programs, we do offer funding opportunities. So I recommend going out there and seeing if you need a funding opportunity, to go through all the different funding opportunities we have. And then we also offer workshops. So we have the Better Choices, Better Health workshops. There are 4 of them. The first one is the chronic disease, which is designed to help adults living with different physical or mental conditions and caregivers come together and learn new ways of problem solving, create action plans, and manage multiple chronic disease conditions. The second one is diabetes, and this one focuses on living with prediabetes, type 2 diabetes, helps caregivers, and emphasizes will be placed on monitoring identifying symptoms such as hypoglycemia, preventing complications, foot care, and menu planning. Our next program is Better Choices, Better Health Chronic Disease Workshop, and this is offered to adults with chronic pain, and patient or participants will learn the difference between acute and chronic pain, how to pace activities, how to prioritize rest and balance life. The next one is Better Choices, Better Health work sites, and this one supports employers for their employees. So this provides a lot of information on how to manage employees' health, well, not manage their employee health conditions, but how to basically help employees balance work and stress life and emphasize stress management. Stacy did a wonderful job talking about our Avoid Opioid program, which is a joint effort between us and DSS. So I'm going to kind of skip over these, but some of the resources I do want to point out that she did not mention is on our Avoid Opioid website. We do have a new emergency department toolkit. So this is going to help healthcare providers walk through an overdose when a patient comes into an emergency room department. And this is new. I believe it was released in January 2020. Stacy talked about the resources that we do have available. So we do have a hotline, and then we also have a texting service. And then other things that we do promote is take back, drug take back. So we do participate in the National Drug Take Back Day, but we also have, as Stacy said, places that you can get rid of your medication. We offer Dispose RX, and then as you mentioned, we also have the Lockbox program. And then additionally, we have numerous resources available, and we are currently working on developing more resources that we hope to have out soon, focusing on overdose and having resources for loved ones who have had a person suffer from an overdose. Our tobacco control program, again, is divided up into two different elements. The first element is focusing on cessation efforts and getting South Dakotans who are currently smoking quit. We focus on 5 priority populations. These populations have a higher rate of smoking. So these populations are Native Americans, pregnant and postpartum women, people with behavioral health conditions, people of low socioeconomic status, and youth under 18 and young adults. We are currently working on new materials for our behavioral health, and hopefully those will be released in the next few months. And then just some information about our South Dakota Quit line. This is open to South Dakota residents who are 13 and older, if they are a tobacco user. And something many people do not know is that this also includes e-cigarette users. They need to be ready to quit or have quit in the last 30 days. And we do have it where you are eligible to re-enroll. And we have found through numerous studies that if a person uses a coach, they are 2 times as likely to quit and stay quit. So our resources here have really helped South Dakota. And then these are the different services we offer. So we do offer a Kickstart program, which offers 2 to 4 weeks of supply of nicotine replacement therapies such as patches, gum, or patches and gum, and then has a quick guide in there. The second one is our postpartum program, and this is for people who are trying to quit while they are pregnant. Must be at least 2 weeks from their due date. For postpartum relapse prevention calls. They do get a gift card incentive, and they are eligible to re-enroll immediately. And then we also do offer medication, but that does need to be supplied by or have a prescription. And then here are our 4 tobacco websites where you can find information. The Rethink It brand is youth focused. The second one is Find Your Power, which is our Native American specific brand. The Be Free tobacco brand is focused on advocacy. So this is where we have all of our tobacco policies. We have our media library. We have data dashboards. We provide a lot of different information. And then our Quit line is our sensation program. And that's where you can sign up to quit. And then immunization is a program new to me. So I'm going to try not to baffle this, but they explained it to me. So Vaccines for Children, or the VFC, is a federally funded program for the Center of Disease Control that began in 1994. The Advisory Committee on Immunization, or Advisory Committee for Immunization and Practices, the ACP, I can never read initials, ACIP approves vaccinations to be included in this program. The CDC buys the vaccines at a discount and then provides free vaccines to eligible children. So who is eligible are Medicare eligible children, uninsured, American Indian or Native American, and then the underinsured. And then what does this cost? It's the vaccine itself is free, and then they have an administration fee. And children cannot be refused if a parent can't pay. And then here are all the vaccinations included. And that went faster than I thought. So I guess I do have time for questions. And here is my contact information. Any questions out there?
One of
Thanks,
the
Rebecca.
questions that I have is I'm wondering if you can speak to like the funding opportunities that are available for tobacco prevention for schools and communities to apply for.
Yes, so we actually do have 2 tobacco grants. I believe both of them just closed, but we do have the Tobacco Disparities Grant, and the Tobacco Disparities Grant specifically focuses on working with one of our priority populations. So that is working with Native Americans, pregnant and postpartum women, behavioral health, low social economic status, or youth. And that one, I believe, closed about 3 weeks ago. And then we have the community and school partnership grant. And this year we actually separated it. So it's no longer a partnership grant where you had to have a community and a school. You only had to have one. And this one is you focus on 2 of our goal areas in our state plan, and you do specific activities. I believe this grant closed last Friday. I should say both grants are up to $25,000 in funding, and it is a 1-year grant. Okay. Any other questions?
And so those grant opportunities are basically available in the spring for the next
Yeah.
year. Okay.
Yes, usually they open in January and close late February or early March.
But if folks are looking for some other additional funding sources, if you went to the health, what's the one?
Good and healthy.
Yeah, there might be some available on there, right?
Yes, I'm actually gonna pull this up really fast. Sharing my screen very fast and I can pull up that funding website. Thought I had. Okay, my apologies. It's taking a few seconds. I thought I had it bookmarked. I do not know why it's not loading for me. It's not a good sign.
I was able to pull it up, I think. I'll share my screen.
Okay.
That's my email, but can you see it?
No, not yet. Oh, now I can.
That's Healthy SD.
Oh,
That's the other one. I'm just not sure why this one is not.
okay. I had Waco Community, that one's closed, but this one had the blood pressure, work well grant.
Yes.
Communities that care is closed. I thought that was like a continual running funding one.
Yes, the Communities That Care has been extended. I do need to update that one.
Okay.
And then Work Well Wellness Grant. We have that one.
Do you know about how many work well wellness grants you gave out the last funding round?
I do not off the top of my head. I will have to reach out to them to know that information.
Just curious.
Yeah.
All right, are there any other questions?
If not, we'll give you 25 minutes back to your day. No one's probably going to complain about that, right?
No. And just remember this when we do go over in another time or something like that, right?
That's great.
Forgiving. And I'm glad that Michelle mentioned that we start at 10 Central Time or 9 with our SAPST classes that are coming up here, because I had it written down wrong in my calendar. I'm the one that made the agenda, but I wrote it down wrong in my calendar, so whatever. I would have been late for my own show. So thank you, Rebecca, for sharing the resources from Department of Health. We sent out the attachment right before with her PowerPoint, and her contact information is on there. So if you have any questions, feel free to contact her or Stacy from DSS if you have questions as well. So with that, we're going to let you go.
And we will see you on the 12th.
Thank you.
Yes, thank you.
Bye.
Bye.
Okay.
Thank you.